So, thank you. So today I'm going to be talking about some of the research that we've done during Pathfinder, looking at what people think about sharing mental health data and how we can help people have more confidence in the work that we're doing. Some of you may have heard a bit of this before, but don't worry, there is new data coming, so don't log off just yet. So, having a look at where we are at the moment, we conducted a UK-wide survey of about 2,000 participants to find out what people think about sharing health data. As you can see, there's a pretty high positive response, with about 90% of people being willing to share health data. There is a slightly increased willingness to share physical health data, although I would draw your attention to the fact that this graph is cut off at 80% here, so this difference is actually pretty small. What we find when we divide the sample by people with and without experience of mental illness is that people with experience of mental illness are a little bit less willing to share both mental and physical health data when compared to people without experience of mental illness. We found similar results from a cohort event that was held in 2018. This was an event where people who were either participants in one of the Scottish cohorts or relatives of participants were invited to come along and learn about some of the research that had been done with their data. So that was cohorts such as Generation Scotland and Lothian Birth Cohort. And what was found when these participants were asked to answer regarding their willingness to share routinely collected health data was a very positive response again. As you can see, it's a fairly similar number to what we found in our survey. But some of you will obviously be asking, but of course they were positive about sharing data because they were taking part in research, or in the case of the relatives, they at least were interested in research. And you would be right. We have to be aware that this isn't a fully representative sample and that there may be a slightly different response if we could capture the whole population. And at the same time, although 10% is quite small, if you scale that up to the whole of the UK, that's about 6 to 7 million people who are wary about sharing mental health data. So what can we do about this? I'm going to present 3 ways which have come out of our Pathfinder research, which we think can help people to have greater confidence in mental health data science going forward. So the first way is to present work conducted by my colleague Iona Benj, which is focused on public engagement. And what we find from the literature is that generally, the more people know about what we're actually doing with the data, the more positive they feel about sharing that data. And so, as part of our Pathfinder work, we, led by Iona, we have looked to inform people as much as possible about what we do here at Edinburgh. So we have a series of activities which can be taken along to science festivals. The first is to represent stratified medicine, which is the idea that you match antidepressants to individuals according to their genetics, which can help reduce the costly trial and error process that a lot of patients go through. And at the Science Festival, we represent this by having paper chains of people where the children can colour in the people, and then on the back they stick on DNA stickers of different colours, and these match up to the pretend antidepressant blocks, which are also different colours. There's also the risk and resilience game. This is designed to show that getting depression or another mental illness is not a zero-sum game, and that there are various factors that increase or decrease risk. So in this game, the child or individual would roll the dice, and that would tell them which disc to pick up. So for example, they might get a genetic disc that was quite a big one representing a high risk, or a smaller one. And when you stack these discs up, you find out if you've gone over the line, indicating that this hypothetical person might be at risk for depression. Finally, there's the card swiping game, and this is designed to represent a research project. People are asked to respond to the cards and to keep knowledge, ethics, money, and people in balance. So, for example, you might hire a new person, which might increase your knowledge but reduce your money. And you have to keep this going for as long as you can. What Ione has been working on more recently is My Depression, Your Depression, and these are stories of people with experiences related to depression. So this includes 4 groups of people: adults with depression, adolescents with depression, relatives of people with depression, and researchers working on the topic. And we're going to see one of these a bit later on. So these are going to become really useful resources for our public engagement in the future. Another related issue is policy engagement. During the course of Pathfinder, we've met some policy makers and we've highlighted some of the issues that are important for us as we go through our research process. So, for example, the fact that sometimes it can be quite difficult to access data that Matthew has been talking about. We can tell the policymakers about this and look for ways to make it more streamlined. Can also respond to consultations such as those from the Scottish Parliament, who are working on their mental health strategy at the moment. So moving back to the work that we conducted with the UK-wide survey, we looked for lots of factors that might influence willingness to share mental health data, and actually not very much came out, except that satisfaction with clinical services was highly related to willingness to share mental health data. And you may remember the first slide that we presented was suggesting that people with mental illness might be less willing to share their mental health data. However, once we take satisfaction into account, people with mental illness are actually more likely to share their mental health data when compared to people without mental illness. So it may be that mental illness is related to less willingness to share health data, but perhaps a more plausible explanation is that mental illness is linked to lower satisfaction with the NHS, and that this in turn is linked to less data sharing. And this doesn't seem to be driven by satisfaction with mental health services. People with mental illness are less satisfied with physical health services than people without mental illness. So I'm sure there's some clinicians watching who are already doing everything they can to keep satisfaction levels high. So again, this is another level where we need to work with the policy engagement to show people that at that level how beneficial it would be to improve satisfaction with the NHS. And also we need to prioritise people who have experience of mental illness, because it appears that they may represent a group of people who are having a less positive time when it comes to NHS clinical services. So on a similar line to that, the third way in which we can help people have more confidence in mental health data science is by making sure that people with experience of mental illness are included throughout the research process. And this is something we've done with our Delphi study. We brought together a group of people with expertise in data science and mental illness, and we worked together with them to produce an output, which I'll show you in a second. The expertise in data science was, for example, a relevant degree or research experience, and the majority of people were living with mental illness at the time they took part in the study. So this led us to create a best practice checklist for mental health data science, and this is designed to be both scientifically rigorous and inclusive of the views of people with mental illness. And it's divided into what people like me and you can do today as we're working on our projects, and what the wider community can do in the future, for example, by capitalising on the work that Heather has been doing on natural language processing for extracting de-identified data. So this checklist is open access and can be found at our website. There's also some case studies provided by some of the people who are here today, and also our wider Pathfinder colleagues across the UK who have helped us to demonstrate ways in which these checklist items can be put into practice. So anyone who is interested in this checklist is invited to come along to our launch tomorrow, where Sue Fletcher-Watson will be talking about what we did and what is in the checklist. So in summary, people are quite positive about sharing health data and mental health data, but there are things we can do to increase that trust in what we're doing. And these are things such as public engagement, satisfaction with NHS services, and making sure people with experience of mental illness are included throughout. So thank you to my collaborators, especially Iona Benj, who has conducted a lot of the work I presented today, and to the MRC for funding the Pathfinder grant. And thank you for listening.